So shalom, good afternoon, good evening, and good morning, depending on where you're following this meeting from. I'm really happy to see that we have participants joining in from all over the world. To all of you, welcome to this Bayer Israel initiated event on digital health. My name is Hugo. I'm the Managing Director and Country Division Head for Bayer Pharmaceuticals in Israel, and I will be the facilitator for this meeting. So we started planning this meeting in the middle of the COVID pandemic, but we did not want this meeting to only be about COVID. The revolution in digital health started long before COVID. It may have accelerated during COVID, but the enormous innovation and changes we are witnessing will for certain continue long after COVID is gone. But in order to drive innovation and change, we need innovative people with an entrepreneurial mindset who are willing to set the agenda and lead the way. And today, you will meet some of these people. Sean Karen, Senior Vice President of Digital and Commercial Innovation from Bayer is here. You will hear from Sigal Rosenberg, who is the CEO of Meuhedet, one of the 4 Israeli sick funds. Eyal Simlichman, Deputy Director, Chief Medical Officer, and Chief Innovation Officer at Sheba Medical Center here. And also, in addition, 2 great representatives from the innovative Israeli ecosystem, Kira Radinsky from Diagnostic Robotics, and also Eyal Baum from Taito Care. We will move on in our program to our next speaker. And a while ago, I opened up a local newspaper, and there was an interview with the next speaker. And the introduction was the following: you should always dream and dream big so that you ensure that you leave a mark in all that you do. These are the words of our next speaker, Sigal Rosenberg. Mrs. Rosenberg is the CEO of Meuhedet, which is one of the 4 Israeli sick funds. And she is the first woman also to lead a sick fund here in Israel. She has a loud voice, and she's an outspoken ambassador of the digital transformation that is definitely needed in the healthcare system. So, Mrs. Rosenberg, please, the word is yours.
Hugo?
Yes, we can hear you.
Okay, thank you for the presentation. I can't see my slides. Okay.
It comes here.
Okay. So, okay. Today, in 10 minutes, I will introduce you the digital health transformation factor in strategy, in the strategy of Meuhedet. A little bit about Meuhedet. Meuhedet is the 3rd health HMO in Israel. We serve 1.2 million members. We are really early adopter of new technology, and we seek for disruptive models. That's what we like to do. We are pioneer in the concept of hybrid medicine, not call center, really hybrid medicine, and I will speak about it later. Offering vast health services with the best doctors and medical teams through a multi-channel accessible approach. Using a really robust digital platform. We have 3,500 physicians, 1,000 nurses, 300 clinics, 120 pharmacies, 100 dental care clinics. We have ownership of the 2nd largest private hospital chain in Israel. It's called Medica. And we have a living innovation lab for new technological and models, providing fast piloting and scaling up capability within the organization. This is Meuhedet. And like the early speaker thought, the healthcare trends are really more integrative, more available, more personalized, and more affordable. This is our new era. This is what's going in the 5 or 10 years. We are going all together to develop and create a new, I think, a new healthcare system The disruption opportunities, as we can say, provider-level disruption trends. The self-care will not be only the self-care. We are going to stretch the abilities until reach a more advanced stage. Like self-care can be like a little bit like the nurse practitioner, the family personal. The nurse can be a little bit like a family personal care physician, and the family personal can be like a specialist. And also in the point of care of disruption trends, I think the home will be something else. Also the office, maybe less clinic. The outpatient will come maybe home or office, and the hospital will be something else that is not the models that we know today. I think this is the trends that's we are going together to create. Digital health as a core pillar in Meuhedet strategy. We invest in a robotic telecare platform with the Amwell. I think we are the first to introduce a hybrid primary care service in the primary care, in the basic primary care. All physicians in Meuhedet have the system, but it's only a system. It's only a platform. Now our responsibility is to do something else with this platform. In the Corona was the best CTO, the best accelerator for digital trends or digital services. But now, after we have the platform and also the doctors and the patient know how to use it, it's our responsible to do something else with this platform, or not only a visit, to create a really ecosystem to the patient during his journey and during his needs, hybrid, also digital and physical meetings. And I think I'm very exciting because I think it's really only the start of beginning of really new. The second thing that we are doing now in the digital area is providing services. Not to go. The patient can not go to the ER because after 7 o'clock or 8 o'clock when the clinics are going, they are closed. We have an emergency care. We can talk with the doctor, digital or telephone. The doctors can connect services with another specialist. We have from house and off of the clinics remote expert centers. We are using really a lot of services at home and in the clinics for the patient. Instead of going to the hospital or to the ER or the outpatient, and it's used for them. Now in these days when there's a lot of traffic and a lot of time going from hospital to hospital, from clinics to hospital, this is really very good services. We are going to hear about title here. Also, Meuhedet have the sensor at home. Also, the home is going to be the new clinic. Maybe the home will be a clinic. It's only the start of. We have a lot of patients that waiting for us to develop really a clinic at home. The title, we have a home diagnostic lab, and now we have a lot of in our lab a lot of sensor that can provide services from the house or from the home of the patient. Sorry. Decision support system. Also, the patient, also the doctors needs really decision support system. Also to reduce malpractice and also to increase quality. And we are also developing now a lot of decision support system. This is, for example, for pregnancy, but we have a lot of decision support system. Also, in healthcare, there is a lot of bureaucracy. We have certificate center for surgery, for drugs, for consolation, refunds of invoice, and we do a lot of automation for the patient to reduce the whole bureaucracy, and he can from home to ask for or the doctor for him or the patient himself to ask for one of the drugs or one of the surgery, and in 1 minute he got an answer for his request. Back in the days, we have 4 days or 5 days until you get an answer which kind of medication they recommended, and if to do the surgery, not to do it, to go to specialists, which specialist. And now we do a lot of automation about the whole administrative area and fields. Remote monitoring and management of special population like corona, CHF, pregnant women, COPD, chronic patients. I think control and monitor tools are needed, and they are great for special population. And also in this area, we are going to increase and also to do some of them hybrid, some of them with the call center, digital, and some of them with the doctor, the GP of the patient. Is it a great outcome and a great patient journey, and I think our purpose in Meuhedet is really striving for exceptional medical services experience. I think we are coming here in the morning to do this, really to do an exceptional medical service experience, because people are sick and also not sick. Also, people are wanted to be better and healthy. And we are here to developing transformational models of next generation, how to do healthcare, some smart hybrid medicine, high quality, available, accessible, efficient medicine, with unique personal service experience. I think this is what I'm coming every day to my office. And this is the potential collaboration areas that I can see for the future: patient adherence, engagement and disease management, prevention, education to patient and medical teams, value-based medicine models, and also a lot of clinical trials. I think this is our really the area that we can do a collaboration with hospital, with pharma, with other suppliers. Thank you very much.
Thank you so much, Sigal, for that great presentation. And, I had the pleasure of talking to you a few weeks ago when I asked if you could be a speaker at this event. You made some excellent points in the interview, and you just confirmed them when we talked. And one of the things that we talked about, and I would like you to share with the audience, is not everybody is a digital eligible patient. So how do we ensure now going forward that we're able to provide the same professional care for the patient, for any patient type that is out there?
I think this is the really challenge to do the hybrid one, to design every service also digital and also physical. So now in these days, where in design services, they design the services also for people that we know that they can't be really digital. And also we are going to use the TV at home, and it's it's only a course with double click, the TV, and we'll bring on the TV at home some of the services, but some of them will be physical also. So to design these services also to very digital people, and some of the people maybe will use the TV, and some people will not use not the TV and not the digital. This is, I think, the challenge, and we have to do also because I think maybe 25% of the people will not be able to use the digital, and it's a lot of people. 25%, it's a lot of people that we continue bring the medicine like we did before, but we have to be better also with them. So we design new things also for them.
Fantastic. And listening to you and seeing everything that you are able now to offer patients that come in, what is the feedback? Are people happy with this change? Are the patients happy with this digital change that is taking place?
Okay, so the patients who use it are very, very happy. They are thrilled, not happy. I get today, even they sent me, some of the patients sent me a book to read, like a thank you. One of my patients sent me today. Who is using it? They are thrilled. They say, "Wow, I'm in 5-10 minutes from my office or from my home. I'm finished all my question or discussion with my doctor or my nurse, or with my nutrition or psychology." A lot of people use it. I think the implementation will take a long time. I think the acceleration of the corona was huge, but we have to bring new models how to promote the health of the patient during these models to recognize to the people the digital. I think only digital, only to put platform or robust platform, good platform. It's not the good implementation. I think with the new models to convince the patient that it's okay to use also digital and also digital and physical visits together will be much better than only physical patient. We have a trip to do. We have a roadmap.
Fantastic. I absolutely agree with you. And again, thank you so much for sharing your thoughts and ideas with us tonight. It's highly, highly appreciated. I'm just getting feedback that your message is now getting through to all the continents around the globe. So this is truly a global message you're sending out tonight. Thank you so much
for your presence.